Board website. It's possible to check actually the list of the that have been registered.
And Dr. Odenyo, what is the Pharmaceutical Society of Kenya doing really? Because I think you are an umbrella body for the pharmacists to ensure that there is public trust as far as the industry is concerned. Yeah.
Okay, yes, the Pharmacy Society of Kenya has been very active on this front in terms of engaging the government, parliament, stakeholders, policy makers in trying to ensure that there is better regulation, yeah? And we've had some of our members...
And would you say there is better regulation now?
There is better regulation, but it needs to be strengthened. Yeah. And not only strengthened, you see, the health sector is really moving at a very fast pace, yeah? You can look at what is happening in the US concerning the AI and new things coming up, yeah? So if you look also in the pharmacy sector, there are things like biotherapeutic medications which are coming, biological drugs. You see, these are things which can only be handled by a specialist pharmacist who has been trained. And when you look at the scope in which pharmacy has evolved, you find that these days we have pharmacists who are, like my colleague said, medicine therapeutic management. You find that there are pharmacists who are specialized in hypertensive medicines. You find that there are pharmacists who are specialized in diabetic medicines, those kind of cadres. So this is what we are trying to push in terms of increasing the role of pharmacists and giving more access to pharmacies. Yeah. Because I think also when the devolved government came, you find that our laws still remain the same. Yeah. And that is why sometimes we have challenges maybe in the counties in terms of employing pharmacists and ensuring that pharmacists are in each and every sector, in the hospitals especially. Because I think it is a common knowledge. Most of the time when we interact with patients, for example, when you're dispensing a medicine, yeah, a pharmacist does not just sell for you that medicine. A pharmacist will talk to you, will try and ask you, what has the doctor told you? And I can guarantee you 90% of the time, the patients don't know what they've been prescribed or how to do it. And you see, it is that pharmaceutical knowledge that will be able to guide these patients. So that, for example, there are some drugs probably if you take a way of excretion is maybe the urine will be orange, or maybe when you go for a long call, your feces will be black. You find that these are things that pharmacists already have that knowledge, yeah? And instead of a patient panicking, it's the pharmacist who can be able to come and tell the patient, okay, this is not a side effect, this is not a bad, this is just part of the excretion of that drug. Yeah. Yeah, and one major important thing that we also want to highlight concerning the Kenya Drug Authority bill is that to get hold of the problem that you're saying, the sibling rivalry and things like that, the Pharmaceutical Society of Kenya is trying to push for a pharmacy practice bill, yeah, which a proposal has been made, and I think also this has been submitted to Parliament. And we are really asking the parliamentarians to take this seriously, because if we don't put these regulations in place and these specializations and people to do the jobs that which they are trained for, this is an effort in futility in terms of improving the healthcare of the country and being able to give patients the quality of medicine that they deserve, that are safe and efficacious.
All right, and time is not on our side. We have to wrap it up now, but thank you so much, Dr. Bethel Libea, for being here. Also, thank you, Dr. Mesha Odenyo, for making time for us. I wish you all the best in your campaign today.
Thank you very much.
All right, that brings us to the end of the News Center this Monday morning. Thank you for watching. I'm Purity Musenzuki. Keep watching KTN News, and God bless.